Oh, very good morning to my dear students. So today I'll be discussing about arboviral diseases. So let's see what are arboviral diseases. So before that, so they are also called as arthropod-borne diseases or arthropod-borne viruses. So these arthropod-borne diseases are caused by arthropod-borne viruses. So what are these viruses and how are they defined? So these arthropod-borne viruses are defined as viruses which are maintained in nature principally or to an important extent through biological transmission between susceptible vertebral hosts by hematophagous arthropods. So the disease is maintained between vertebral hosts by hematophagous arthropods. So these arthropods are maintaining the diseases within the vertebral hosts. So what are arthropods? So arthropods are insects or it can be for example it can be your mosquitoes, your ticks, your mites, your ants, flies, all these are called arthropods which do not have an exoskeleton. So they multiply in the tissues of arthropods. The viruses multiply in the tissues of arthropods and are passed on to new vertebrates by the bite of these arthropods after a period of extrinsic incubation. So the viruses multiply in these arthropods, and when these arthropods bite a vertebrate host, the disease is transmitted. So by vertebrates what we mean is any animal or any human being or any living organism which has a skeleton is called as vertebrates. So it can be animals or human beings. So this is a definition of arthropod-borne viruses. So what is a classification? So you have group A and group B arthropod-borne viruses. Group A are called as alpha viruses and group B is called as flavivirus. So the examples in group A are Sinbis and chikungunya. Group B are dengue, KFD, JE, yellow fever and West Nile fever. So we will get into details of all this later on. So what are the clinical syndromes which these arthropod-borne viruses can present with? So first one, it could be the febrile group, then you can have the hemorrhagic fever group and then the encephalitis group. So in febrile group, which is a benign condition, the patient may have just a fever which is with or without rashes, and the patient may present with joint pain as well. So examples of febrile group are Sinbis, chikungunya, dengue and KFD. So the hemorrhagic fever along with fever or along with the febrile and in addition to the febrile group symptoms, you will also have hemorrhagic manifestations. So here the mortality is high in hemorrhagic manifestations. So example again here is the same dengue, chikungunya, KFD can either present as just a febrile group or with hemorrhagic manifestations. When hemorrhagic manifestations are seen, so the mortality is high. So what we mean by hemorrhagic manifestations are bleeding. So it can be bleeding within the capillaries. So sometimes which may not be visible. Then the third syndrome are encephalitis group. So this is associated with considerable mortality wherein you can notice the encephalitis. So the CNS symptoms, CNS is involved and you can see the CNS symptoms. So examples of encephalitis group is your Japanese encephalitis, what we normally call as GE. So now let's see the first disease, the four principal diseases we will see in detail today. One is KFD, one is Japanese encephalitis, followed by yellow fever and chikungunya. KFD and JE, that is Japanese encephalitis, I will be presenting in this PPT. Yellow fever and chikungunya, I will give it as a next PPT or a next discussion. So now let's see what is KFD or Casneur forest disease. As you can see in the slide, what is that you can see on the leaves there? So those are ticks. So this disease is transmitted by ticks. So the tick also is an arthropod. So now what is the history of KFD? So it's a Casneur forest disease. It is called as KFD because this disease was principally seen in Casneur forest area, which is located in Shimoga in Karnataka. So heavy mortality in two species of monkeys were noticed in 1955. these monkeys were found in the forests of Shimoga, which led to the discovery of Casno forest disease, as these monkeys were seen in the Casno forest. So mortalities in monkeys were followed by acute febrile prostrating illness among villagers, and few human deaths were also seen. So you can see that then the autopsy on monkeys were performed. So this is the place of reporting of first monkey death in March 1957, the picture which you can see on the right side. So autopsies on the monkeys revealed that the death of the monkeys were due to the arbovirus. What happened? Sorry. Okay, the next slide. So now, Casno forest disease was found in India. So it was limited originally to Shimoga district in Karnataka. So around 800 square kilometers around the Casno forest, this disease was found. And later on, newer foci were seen in 3 districts, namely Uttar Kannada, Dakshin Kannada and Chikmagaluru. So which covered about around 6,000 square kilometers. And sero surveys also revealed that KFT was seen in Kutch in Saurashtra. So what are the agent factors? Like any communicable disease, you have the epidemiological triad, which is agent factors, host factors and environmental factors. Without this triad, your natural history of the disease is not complete. So now let's see what are the agent factors of KFD. KFD is a febrile disease associated with hemorrhages caused by an arbovirus, which is flavivirus. So the agent here is a flavivirus, which is a group of arbovirus. So it is a member of group B togavirus family. And what are the host factors? So what are the host characteristics which attracts KFD? So age, majority is seen between 20 to 40 years of age group, because as I said, this is mostly seen in monkeys in the forest. So this is the age group wherein people venture into the forest for either it can be hunting or for cutting wood and for any other purpose. And it is usually seen in males, because males are the ones which go to the forest or which enter the forest areas. Occupation again, cultivators who visit forests with cattle or cutting wood are the main people who are affected. And epidemic correlates with peak human activity in forests, that is between January and June. So between January and June, you see that many human activities take place in the forest because it is dry season. After June it is monsoons, and because of rain the human activity decreases. Now let's see the natural hosts and reservoirs. So any virus or any organism for that matter, we should learn where do these viruses live, where do these viruses multiply. So who are the natural hosts and who are the reservoirs. Now, so the natural hosts and reservoirs in KFT, it circulates in small mammals such as rats and squirrels, which acts as the main reservoirs. And neutralizing antibodies have also been found in cattle, buffaloes, goats and porcupines. And these are the maintenance hosts. These squirrels, rats and cattle, buffaloes, all these are called as maintenance hosts because they maintain the virus in the nature. They maintain the infection in nature. So the virus is continuously circulating amongst these animals. So that is the reason why they are called as maintenance hosts. So we do not generally have any problem with these maintenance hosts. So how is it affecting humans? So the humans are affected by the amplifier hosts. So monkeys are the amplifying hosts for the virus. So what do we mean by amplifying for host? So here the multiplication of the virus takes place at very high levels such that the intensity of infection is very, very high. So through amplifying hosts, the viral load is too high, and from these amplifying hosts through the vectors, the humans get infected. As you all know, the vector here is tick, as I've shown in the first slide. So how is the natural cycle maintained? So in enzootic states, the infection is maintained in small mammals and also in ticks. So enzootic, so within the animals or amongst the animals, so it is maintained amongst mammals and ticks. And when monkeys come into contact with these infected ticks, they get infected. So these ticks go and bite the monkeys and they carry infection to the monkeys. But when monkeys are infected, here is a problem wherein they amplify and disseminate the infection. So they multiply to a large extent in monkeys. So humans in these hotspots where monkeys are found are infected by the bite of ticks again. So these ticks bite the monkeys wherein there are a lot of virus, and these ticks again bite humans, and through which we get infection. So this is the natural cycle. So the vectors, as I've been telling, tick is a major vector, and there are around 16 species of ticks. But you just have to know that tick is a vector for Casno-Forest disease, and monkey is an amplifying host. So when these ticks bite the monkeys, and the same they pick up virus from the monkeys, and when these ticks again bite humans, they transmit the infection or they transfer the infections. So these ticks can act both as vectors and reservoirs of infection in KFD. So it just doesn't pick up the virus from monkey to humans. They also act as reservoirs of infection. These virus remains in the ticks. So these epidemics coincide with nymphal activity of the ticks. So usually when in the life cycle of ticks, during the nymphal activity is the period wherein the virus is transmitted to a large extent. So the nymph's most important stage for human transmission of infection, as viremia is significant in nymphal stage of ticks life cycle. So the adult ticks feed on cattle and viremia is not significant. So generally when the ticks become adults, they feed on cattle. So and the viremia is not very significant. Only the nymphal stages which feed on humans and which would have fed on monkeys, so they transmit the infection. So again, the mode of transmission by the bite of infective ticks. As I said, the nymphal stage is more active in transmitting the infection. And when it comes to humans, it is a dead end. It's a dead end infection in humans. Human to human transmission is not seen. Okay. So there is no evidence of man to man transmission. So what are the clinical features of KFD? So you have an acute phase with sudden onset of fever, headache, myalgia and prostration lasting for 2 weeks, and GI disturbances are seen, hemorrhagic manifestations are seen in severe cases. In the second phase, it's characterized by mild meningoencephalitis after an ephemeral period of 7 to 21 days. So you see that the person is in the ephemeral period of 7 to 21 days, after which you can see meningoencephalitis. So this is the second phase, and the case fatalities varies between 4 to 16%. So treatment for any viral disease, as you all know, it is always conservative treatment. So if there is fever, give antipyretics. If there are joint pains, give analgesics, and any supportive therapy as required. Now the next aspect is how do you diagnose? So clinical diagnosis. Any diagnosis first will be through clinical signs and symptoms. So diagnosis by suspicion by clinical signs and symptoms, and by history, to when they give you a history of occupation or travel into the forest, and detecting the presence of virus in the blood. The virus can be detected in the blood, and serological evidence by hemagglutination and immunofluorescence. So any diagnosis of any disease is by history, and then the clinical presentation, and then comes your laboratory diagnosis, which is either by the presence of virus in the blood or by serological tests. Now what next is how do you control? So timely control decreases morbidity and mortality in humans. So first and foremost you have to control ticks. So how do you control them? By aircraft mounted equipments, you can dispense the chemicals which can kill the ticks, such as lindane, carbaryl and phentheon at 2.24 kg per hectare at forest floor. spraying carried out within 50 meters around hotspots. So whenever you see a hotspot is a spot where then there are a lot of monkey deaths. So around 50 meters around that area, this chemical is sprayed. So and you have to restrict the cattle movement, which brings in reduction in vector population. So cattle attract a lot of ticks. So they provide a blood meal for the ticks. So to decrease the tick population, you have to restrict cattle movement, which brings reduction in vector population. And again, personal protection, adequate clothing so that you don't get bitten by ticks, and insect repellents can be applied such as the DMP DEET, which provides 90 to 100% protection. And you can examine at the end of the day and remove the ticks if at all if they are present. And of course, health education should be given to the individuals regarding personal protection. And vaccination, KFT vaccine is available, which is inactivated chick embryo tissue culture vaccine, which is developed by NIV Pune. So neutralizing antibodies is seen in 70% of vaccinated persons. So vaccinating at risk population, that is villagers living near forests, forest workers and occupational personnel concerned with the forest can be vaccinated. So this is about the Casno forest disease. So next, let's see what is JE or Japanese encephalitis. So this was initially, this arboviral disease was initially seen in Japan. So that's why it's called as Japanese encephalitis. So again, let's see, look into the epidemiology of JE, any communicable disease. You have to know the epidemiology. So what is the epidemiology? So it's a mosquito-borne encephalitis caused by group B arbovirus. Again, this is group B arbovirus, which is mosquito-borne, whereas KFB was tick-borne. So it is transmitted by mosquitoes, and again, which type of mosquitoes? It is transmitted by culicine mosquitoes. So it is a zoonotic disease. So what do you mean by zoonotic disease? So especially the disease is seen amongst animals, wherein man is an incidental host. So actually it is a disease of animals. So the man gets infected incidentally. That is what we mean by zoonotic disease. So let's see the Indian scenario of JE. So it was isolated in 1955 at Vellore, Tamil Nadu. Subsequently, the outbreaks have occurred in 25 states and union territories of India. So JE virus infection is widespread and is particularly very high in southern states of India such as Andhra Pradesh, Tamil Nadu and some parts of Karnataka. So the agent, as I said, you need to have agent, host and environmental factors for any disease. So the agent factors are, agent is, we know, it is a JE virus, which is a flavivirus, which arbovirus belonging to group B, flavivirus. So what is a natural cycle of JE virus? So you can see here there are two cycles, one on the left side, one on the right side. Left side you can see a picture of a pig and mosquito. So here the infection is maintained in the pig through the bite of mosquitoes. So pig gets infected, a mosquito bites, and this mosquito bites another pig, so the other pig gets infected, and the cycle goes on, and the pig is infected with JE virus, and the pig acts as an amplifying host. So if you all can remember what is an amplifying host, which I have told earlier. So amplifying host is a host wherein the virus replicates in a very fast manner and the viral load is more. So here in the right side, when you see the other cycle, it is between birds. So you can see a bird there. So the infection is transmitted amongst these birds. They are called as airborne birds. So the cycle, the virus is maintained within the birds and within the pigs. So now animal reservoirs, as you know, pigs. Major vertebrate hosts are considered as amplifiers of the virus. So pigs are the amplifiers. So this is a major vertebrate host. So cattle and buffaloes are also hosts, but they are not natural hosts of the JE virus. They just attract the mosquitoes. As they attract the mosquitoes, and these mosquitoes help in maintaining the virus amongst the pigs. And birds or the other reservoirs of JE virus are seen in birds, pond herons, cattle, ergets, poultry, and ducks. So these birds, cattle, and buffaloes act as a reservoir, but pigs are the ones which are amplifiers of the virus. So the virus is transmitted between pigs with the bite of female culicine mosquitoes, and these mosquitoes again bite human beings and transmit the infection. So here what you have to note down is horses are the only animals which manifest JE virus infection. So in pigs and in cattle and buffaloes, even if JE virus is seen, but they do not present with any signs and symptoms. They only serve as a reservoir. They do not suffer from the disease. So horses are the only animals wherein you can see JE virus infection. So what are the host factors? Yes, majority of the cases are seen in children less than 15 years or over 60 years of age, the most vulnerable age group, and males are more affected than females. Population mobility, migration of people from endemic areas to receptive areas. So when population move, when the people migrate from places wherein J is endemic to a newer place, they take the infection from them along with the endemic area to the newer place. Occupation, mostly rural disease and closely related to agricultural practices, because as we see, it's only cattle and buffaloes and some of the birds who are reservoirs of infections, and pigs who are the amplifier hosts. Now let's see what are the environmental factors. So JE is a seasonal disease. So prevalence is from May to October, and this is related to the agricultural practices. May to October is wherein the people go to the fields for agricultural purposes. And rainfall increases the opportunities for breeding of mosquitoes. As we all know, from May to October it is monsoon season wherein you can see rainfall and the mosquito population increases. So these are the environmental factors. Vectors, as we know, are culicine mosquitoes, and some of the anopheles also transmit JE. So amongst culicine, Culex trichiniorhynchus has been implicated as important vector in southern India. So vectors are the ones which carry the infection from the pigs to the human beings. Habits. So breeding habits of mosquitoes or these vectors, let's see. So these mosquitoes breed in rice fields, shallow ditches and pools, and their choice of host is zoophilic, feeding primarily on vertebrate hosts. They feed on any vertebrate host. So that's how they feed on pigs, and again they come and feed on humans and they transmit the infection. So time of biting is usually at the nights. Now modes of transmission. It is transmitted to man by bite of infected mosquitoes, which we know, which is culicine. And again, like KFT, even JE, there is no man-to-man transmission. So man is incidental and man is a dead-end host. What we mean by dead-end is from man it cannot be transmitted to another man. So there is no man-to-man transmission. So the incubation period of JE virus, which varies between 5 to 15 days. So now what are the clinical features? So most of them can go asymptomatic, but in symptomatic patients these are the clinical manifestations, or these are the three phases. One is acute prodromal phase, encephalitic phase, and then recovery phase. In acute prodromal stage is before CNS entry by the virus. So wherein here you can see fever, GI disturbance, headache, malaise, etc. In encephalitis phase, the virus has entered the CNS entry by the virus. So there is rapid onset of high fever. There is neck stiffness, which is characteristic of encephalitis. Seizures, again because of CNS involvement. Spastic paralysis, CNS involvement again. And sometimes it can lead to death. And for people who recover from these two phases fall into this recovery phase, wherein the recovery can be either complete or partial recovery with neurological deficits. Cranial nerve palsies also can be seen. How do you diagnose? Again, as I said, it is through history and then clinical and then laboratory. So clinical should be done carefully, ruling out other similar encephalitic conditions. So there are numerous other conditions wherein you can see encephalitis. So you should be able to do differential diagnosis. Laboratory, again, there are tests available. There is antibody detection and antigen detection tests. Then how do you treat JE? So like any other viral, yes, JE doesn't have any antiviral medications. So it's supportive management. Fluid and electrolyte balance is a must during acute phase. Seizure management is necessary and airway management is crucial. So any viral disease, it is symptomatic management. So how do you control GE? So you can control here, you should focus on controlling the reservoir and focus on controlling the vector. So controlling the reservoir is very, very, very difficult. So birds and various vertebrate animals act as reservoirs. How do you control them? There are so many birds, so many animals in the forest. How do you manage to control them? So it's practically impossible to take care of reservoirs. And pigs act as amplifying hosts. So their virus multiplication is huge there. So pig rearing should be discouraged in areas where rice cultivation is widespread. So all that what you can do, there are a lot of animals and other birds which act as reservoirs, and it is very difficult to control them. But pigs are the amplifying hosts, and so you can only ensure or focus that in an area wherein you can advise people that pig rearing should be discouraged in areas where rice cultivation is widespread. Why pig rearing and rice cultivation is linked here? Where there is rice cultivation, you can see lot of mosquitoes, and when there is lot of mosquitoes, it goes and it bites the pig, and then it maintains the cycle of infection. So it picks up the infection from the pig, and again these mosquitoes bite human beings and transmit the infection. So this is about controlling the reservoir. So how do you control the vector? Here the vector is, what is the vector here? It is culicine mosquito. So you know that there are a lot of mosquito control measures. So mosquito control measures as such is a separate topic. So you have biological control, you have chemical control, you have physical control, and you have integrated vector control, wherein you combine all the methods and control the vectors. So this is actually been done already in a separate chapter. So this is about control of vectors. So how do you prevent? So there are 4 types of vaccines. One is mouse brain derived killed vaccine, cell culture based killed vaccine, live attenuated, and live chimeric vaccine. So depending on the local need, so any one of the vaccines can be chosen and can be given depending on the suitability. So thank you. So why there is a horse in this picture in the last slide? As I told, horse is the only reservoir wherein you can see clinical signs and symptoms of encephalitis amongst animals. Other than humans, horse is the only animal where JE infects and signs and symptoms are seen and encephalitis is seen. Thank you all.